Afternoon, everybody. We'll give people a couple of minutes to dial in. I'm assuming you can all hear me, so hi, Shane. Look at you in the corporate background. All right, it's a couple of minutes past, so we'll kick off. Get rid of some of the windows that are open because that's never helpful. Okay, afternoon, everyone. Thanks for joining in. And as you'll have seen, I've got some company today, so Shane's joining me to answer all the difficult questions. I want to start by acknowledging the land on which I'm standing, which is Wurundjeri land of the Greater Kulin Nation, but also pay my respects to the Boon Wurrung and the Boon Urrung peoples, also of the Kulin Nation, whose lands our sites stand on, and pay my respects to elders past, present, and emerging. I guess the first thing to start with is the office decorations. As you'll see, the Bulldogs had a bit of a win, and someone snuck in and decorated my office. As you can see, the Collingwood shirt is still in there, but like many people, the Dogs are my second team. And I think, you know, it's a huge boost for the West, and it's a huge lift for our patients and for our staff and for our community. So, you know, thanks to all the fans and stuff that are making it special this year, and I'm sure we'll continue to do that across. I know in 2016, when the Doggies won, no one was happier than Leonie Hall, but there's lots of other very positive things, and the tour of the Cup around the sites was a really sort of highlight for us all. So not often you get to touch a Premiership Cup, I'm sure. But I think, you know, it's great that we're celebrating that, and I'm sure, you know, as we get closer to the final, like last time, the houses will get painted red, white, and blue, and fences, and you know, we'll continue to see a lot of Western Health gear, Western Bulldogs gear, sorry, in the West. So, you know, a big part of the partnership work we do as an organisation, and it's great for our community. Staying on a sort of positive note, the People Matters survey. So thank you all for those of you that filled it in. 27% of our staff filled it in, and that's of the old Western Health, if I can call it that, before the amalgamation. So Djerriwarrh as a management team elected not to do the People Matters survey. So we've only got results for Western Health, but 27% was a really good response rate. So that's nearly 2,000 staff. So huge thanks to all of you that filled it in. I'm currently going through the free text comments, and I know Sue Bruce and her team are going through the data to sort of put together the reports and things that come from that. But the three questions that were asked in free text: what can we do better? What are we doing well? And how can we create a more inclusive and respectful workplace? And we've probably got just over 3,200 comments, pretty much 50-50 in what can we do well, and or what are we doing well, sorry, what can we do better? And then just about 800, 900 in terms of how do we create a respectful and inclusive workplace. So some great comments in there, and some great improvements that we can make, and we'll continue to do that. So as I say, I go through every one of those comments and read them. So thank you for everyone that gave time to fill that in. So that's really helpful. New Footscray. So a huge amount of work continues in New Footscray. So thank you again to all of the clinicians and the project team that are involved with that. Design stage 1 has concluded. There are a couple of areas that the project team and small number of your clinical colleagues are reviewing just to close that out. The ED is one of those spaces at the New Footscray, and we're about to move into detailed design. Now that's very different to the first design stage 1, and will last probably well into July next year. So a significant amount of time and a different pace involved in this one. And at this point, we actually do solve the room functionality and kind of where things will be, like doors and light switches and, you know, all those kind of things. So, you know, a lot of Western Health staff will be engaged, but it will be on a much slower time scan and you know, not as intensive as design stage 1. There are still 31 different user groups and 34 reference groups, so a significant amount of work, and a lot of the things, you know, will continue to happen virtually over Zoom because of the COVID restrictions. So again, thanks to all staff that are involved in that. And for some of us, myself included, we've been fortunate enough to go down and see the mock-ups. So Plenary Health have built 9 mock-up rooms in the Kinnear site just down the road. So it's a nice walk down the road the other day in the sunshine to go and have a look. And they're there to look at what a typical inpatient bedroom is, what an ensuite looks like, a mental health bedroom, an ICU room, a recovery bay, an induction room for anesthetics, you know, et cetera, et cetera. So a fair few different rooms, I think I say 9 in total, that we can go through and have a look at. And people have had a great time, you know, looking at. About 100 people have been through in the COVID world. We will have another chance to do that at the end of September, so more people will get a chance to go through, and if the restrictions are different then we can get more in. And then all of that feedback is going into the drawings. So I know, having gone through it and seen some of the sticky notes, people were saying the light switch is too low, or this basket's in the wrong place, or these, you know, suction panels are wrong. So, you know, really valuable exercise, and all that commentary goes into the process. And after the second phase, say end of September, the plenary group take all that feedback away. And then I think it's probably later next year, they build prototype rooms. So they will have the actual, you know, built up rooms that look and feel like they will be when we get them in the new hospital. So as a final check, just to make sure everything's where we want it. The other thing to say is, for those of you that haven't got down and or won't get down on the microsite, not yet, but coming up very soon, the project team are putting in the QR codes of those 9 rooms. So you'll get to look at the 3D images of the rooms and what they will look like. So you're not entirely left out. So, you know, watch out for those, and watch out for the comms from the New Footscray project team. In relation to maternity, lots of things happening in that space. The baby boom continues. I know the team are preparing for over 600 babies in October. So that's going to be really tricky to manage. So a huge thank you to all the obstetric and maternity staff who are, you know, juggling all sorts of things in COVID factors and restrictions with families visiting and things to meet that demand. And I know we're working across both Bacchus Marsh Maternity and Joan Kirner Maternity to meet that demand in the system. And even we might be working with Northern Health to help us as well if that's required, and or the women's. So lots of support, lots of partnership working, but a hugely active month coming up in October. So thanks to everyone for continuing to support our patients. I thought I'd just sort of touch on EMR very briefly. So we're continuing to work with Cerner on the EMR and the timetable. The project team are doing a great job, and Cerner are experiencing some challenges. Some of their people have been lured away to new jobs by other health services and consultancy companies, and with the border restrictions and things, they've been struggling to get some resources in. They're addressing that, but as a result, we've worked with them to pause some of the sprints. So you might have got some time back in your diary. Not that we're stopping the project. We just want to make sure it's appropriate to continue to go forward and get the most out of clinical time. So Lily and the team will continue to be in touch and reschedule those when it's appropriate to do so. But we'll continue to work with Cerner to solve those issues. The final thing before I move on to COVID I wanted to say was we have now launched the Western Health Strategy Directions and the strategy for the next 3 years. It's on the website and the microsites and all those things, but I thought it's just worth, you know, saying thank you to all the people that contributed to that. And I know there's pop-ups going on later this month that people will continue to add commentary into. And it's also, you know, for me, it's a really simple thing. It's about providing the best care with the best people. And our strategy is all about delivering those 2 things. And there's 5 strategic directions. I'm sure you know them off by heart. The first one is that we're going to partner with our patients and family. Second is we're going to care for our people. The third is that we're going to deliver services for the future. We're better together is number 4, and we discover and learn is number 5. And all of the work that we'll be asking the organisation to do will fit into one of those 5 areas about how we continue to evolve and deliver things for the future to be ready to meet the needs of our community but also to continue that innovative and fantastic approach that Western Health has to be on the front foot. So all of the at-home services, all of the capital builds, all of those things will continue to contribute to giving us the best people to deliver the best care. COVID, it's back. If you haven't seen the news, it feels very deja vu at the moment to last year. But I'll start with vaccinations. So a huge thank you to all of the staff involved in vaccinations, and Shane and Lisa are doing a huge job behind the scenes, putting on pop-ups and getting staff in and vaccinating almost anywhere up to between 8,000 and 9,000 members of our community a day. So a huge effort by them and their teams to do that. And having been through many of the vaccination centres myself now with family members to get vaccinated, it's a great experience at all of them. At the moment, there is no mandatory requirement for vaccination. However, that is likely to change in all seriousness. It is coming as of next week for aged care. And there's now legal directions being issued by the Chief Health Officer that means that we legally have to comply with that. So I know at Grant Lodge, the staff are going through that process and working through that. There are exemptions in there. If you get a medical exemption, you don't have to have it, but they're pretty limited exemptions as to why you wouldn't. And there has to be a plan by which all staff have either been vaccinated or have an appointment, and then at a certain point in time in November, you have to be double vaccinated to work. My sense is that that will also come for all healthcare workers across the board, irrespective of where you are working or what your role is. Hasn't come as yet, but I think that's still being discussed and it's likely to happen. We've got plenty of appointments, and I'm sure Shane might touch on that in the questions. So if you're slightly hesitant about getting a vaccine, there are plenty of very qualified people to talk to. There's plenty of opportunity to get a vaccine, and we've opened up the opportunity for your household contacts to also book in and get a vaccine appointment as well. We want all of our community vaccinated, because anyone that's been watching the news recently will have seen the stark contrast of all of the patients that are in ICU and on ventilators, and also inpatients have had either no vaccine for the vast majority of those cases, or one vaccine for a small number. So vaccine is a really important defense against COVID. It's really important to get it in certain areas where it's high risk. We're actively encouraged by government to roster staff that have had the vaccine and both shots to protect you and patients and us. So it is likely to come. Watch this space, but it is a legal requirement for aged care. So as I say, that's coming, and Pfizer is available to all health staff. So if you want a Pfizer shot of any age, you can get it if you work at Western Health. So please not let that hold you back either. In relation to COVID positive patients, we are currently not a designated facility to take COVID positive patients. You might have seen a fair bit of coverage in the news. Northern Health, Box Hill, the Royal Melbourne, Alfred were first line ones. Now they've added Austin and Barwon and Monash. Western Health has yet to be added. I think it's probably a case of when, not if, to be honest with you all. But we have to do some audits of airflows at Sunshine. So that will happen across this week, just to make sure that all of those air scrubbers are in the right place, that are in rooms, and that the ventilation works at required levels. So you may see some activity on a number of wards at Sunshine across the coming week and in Joan Kirner, just to test some of those airflows and locations of scrubbers and things to comply with guidance. So, we're not going to be taking COVID positive patients, I don't think, at this point, for at least probably 5 days or so. But we're likely, once all those engineering tests have been completed, that we will probably be designated as a site and we'll be taking COVID positive patients in the not too distant future. So we'll continue to keep you appraised as to how that moves. But we are planning, we are doing a lot of work. For many of you that have seen the news, they're forecasting, if the current rates continue, that they'll need probably 800 inpatient beds in the middle of October to care for COVID positive patients. So, there's a lot of work that Tash Tui is doing with her team, the CSDs, the divisional directors, to get ready. And my aim and the team's aim is to ensure that we can protect all of our staff and patients that come to us, give them the best care and keep everybody safe. So, you know, whatever you're hearing in the rumour mill, we are not taking COVID positive patients at this point, but I don't think it'll be long before we are. So we'll continue to keep you appraised of that, but lots of other work is going on in the background. And, you know, I appreciate the huge amount of work from all of our support staff and our clinical teams who are also, you know, continuing to rearrange services to patients, move services, flip wards. You know, it's hugely complicated and complex, but we're doing it, you know, in record time to support that best care for our community. So thank you. The final bit for me is to talk about break rooms. Why break rooms, you say? Well, for us and probably many industries, the break rooms continue to be a main area of, you know, weakness and concern in terms of how people are catching COVID. Not through lack of practice, just the way that this virus is highly infectious and gets out once it's in those break rooms. If someone has it as asymptomatic, then more people are likely to get it if we're slightly slack on our PPE. We want to make sure that we can increase the number of break rooms, particularly outside with the summer coming. I'd say today because the sun's shining, the other day it was pouring down, but we are looking to put on more spaces outside to give people more access to break rooms to help, you know, get things aired and moving. We're also introducing a QR code system for break rooms. So I know it's onerous. It actually really helps the ID and the infection prevention teams find you when there are outbreaks and exposures. And we've had a few. So this is coming out of all of that learning from at least the 5 or 6 that we've done so far in the last sort of 3 weeks. So if you go into a tea room to eat, to make a cup of coffee, please just scan in. It's a bit like the SafeVic one. It's really easy to use. It's not onerous, but it means that we can find you and either include you in the testing or exclude you based on when you're in the room and how infectious and risky that is. So, you know, please continue to practice the PP etiquette that I know we're doing. Continue to be, you know, laser-like focused on that because it's really important. Get your vaccinations, please. It could save your life or one of your family members. And, you know, please use the QR codes to give our ID and IP guys half a battle in finding you quickly and stopping the spread into other areas. So thanks all. That's all I was going to say today. I'm very happy to take questions, and Shane's here also to help me answer the really tricky ones on anything vaccination based. And if you've got questions, please stick them in the Q&A and we'll work our way through them. So thank you all, and we'll start getting into the questions. First question, is there an ETA on when the payroll for what was Djerriwarrh be merged into the Western Health Systems? So yes, there is. At the moment, I think it's October. By the end of October, that's due to be merged in. So I know the HR teams are working with both Ballarat and Melbourne at the moment to work through that. We're obviously keen to do it properly because we want people to get paid. So we're not going to do it at a mad rush, but October was the sort of point at which we want to push the button. So we're continuing to work to make sure that that's the date, and we'll continue to keep people updated through the transition news that comes out to support that project. So yes, we are. Can we please get a link to the Western Health backgrounds for meetings? Yep, I'm sure we can. I'll take that on notice to the comms team, and I'm sure we can put the files somewhere that people can reach into a microsite and grab them. I know we've lost Shane and his snazzy background, but I'm sure they're all available, so we can put them somewhere that people can download them and use them on Zoom and things. We won't get Shane to share them all. Here's one for you, Shane. I don't know the answer to this. Wasn't the former Peter Mac in East Melbourne refurbished for COVID patients, and what's happened to that one?
Yeah, so it was refurbished and it's now being operated by St Vincent's Public. So they're calling it St Vincent's on the Park. And so they are using it for, well, previously in 2020, they used it for some suspected COVID and confirmed COVID patients. It's not being utilised for that purpose at this point, but certainly if St Vincent's becomes a COVID streaming hospital, then it may be within their plans. So, but that's yeah, being operated by St Vincent's.
Okay. Here's a good one, Shane. Can family members that are not household contacts still get vaccinated at Western Health through the priority line?
Yes, Russ, the answer is yes. So we're really happy
we'll vaccinate everybody and anybody, I guess, is the
we're
answer.
happy to vaccinate really anyone. Absolutely. So please feel free to utilise that the Western Health staff, family, and household contacts process to be able to register your any members of your family, whether they live with you or not. And if you live with other people as well, other than family, you can register them as well. Now I do have to say we have been, there's been high demand for the service. So we do apologise that there has been some delay getting back to people, but please we ask for your patience at the moment. We're getting through people, and we will get back to you via email with the details of the appointment. We're just asking at the moment that people don't keep on emailing us again, because it's just adding to the inbox that the team needs to get through. But we will certainly get back to people, and yes, you can book in any one of your family or people that you live with via that process.
There's another one shown about saliva kits, the rapid sort of testing pieces that they use overseas. Now, I think that they're coming to be used in Australia for ED and inpatients, but you know any more than me on that one.
So we are using them at the moment as part of our surveillance testing for high-risk areas. So where there's a regime where the staff can sign up to be part of, if they work in the high-risk areas, to have one nasal swab per week, and then up to 4 saliva tests for that. They haven't really been utilised more extensively than that, to my knowledge, at the moment, mainly because the nasal swab test is more accurate. But certainly, I know people are looking at the utilisation of them more extensively in the future.
Thanks, Shane. If a vaccination becomes mandatory across healthcare sector, does this leave clinicians to be legally fired if they decline the vaccination without a medical exemption? I guess the short answer is not legally fired, but I think there's a process to be gone through. That's been set out for the aged care staff in the legal directions. So I'm assuming the same will come into force if that's made applicable to all healthcare workers. But if it's mandatory and you don't want a vaccination or you're not medically exempt, then I think I'm not an HR expert, but you won't be able to do your role, and therefore, there's no redeployment if you can have that. So I'm not sure of the exact technical terminology of it, but I think that's some of the things that are under consideration. But that's certainly been spelled out within the legal directions for aged care, in that staff won't be able to work in an aged care facility. I guess they could be redeployed if there's a suitable alternative role that they could do. But if mandatory vaccination for all healthcare staff comes in, there are no roles to be redeployed into. And I would imagine that's the source of some conversations between unions and IR teams across government and across health services. So I think watch this space is the honest impression on that one. But the CHO guidelines for aged care are available publicly. So you can certainly read those and have a look at the sort of direction of travel that's indicated. And certainly, Shane, from my understanding, a lot of unions are supportive of mandatory vaccination in healthcare, and New South Wales have gone that way already. And, we might get some learnings from that, I guess.
Yeah, I agree, Russell. I think with these things, the devil's always in the detail and how it's actually written. Certainly, it's very clear with the aged care directions that unvaccinated people, and that's paid or unpaid, aren't if they're doing work for the facility, aren't able to even enter the premises unless they've got a medical exemption. So whether that's different for the wider health sector or not will remains to be seen.
Thanks, Shane. is there a date for another vaccination clinic at Footscray so that folk can get their second shot if they work on site rather than have to travel?
We haven't got any plans at the moment, Russell, but it's something that if there was demand, it's certainly something that we can look at setting up as an outreach service again. So happy to take that into consideration.
Okay. And is there going to be any walk-in appointments for staff, rather than bookings like they used to be, either at sort of Sunshine or the showgrounds?
Yeah, so what we're, I suppose, trying to do with the staff process is to try and get people, I suppose, booked in just so they don't have to wait for extended periods. Even with walk-ins, there can be waits for that. So we're trying to use bookings to get people in and out as quickly as they possibly can. And I know that we've set up a separate kind of entry and kind of queuing process for staff and family separate to the public, so there isn't that wait for the general public who, even if they have appointments, sometimes there's a little bit of a wait. So it's really around trying to use people's time as effectively as possible, and that's why we're sticking to bookings.
And I guess the other thing for us that we've had to bear in mind for walk-ins generally is the risk of the COVID frequency and cases in the West. For those of you that follow the news, yesterday, our public health area had 48% of the COVID cases that fell yesterday. So there's still a lot of COVID in community. And we don't want to expose people unnecessarily in a walk-in situation where they may not be adhering to social distancing, etc. So as Shane said, as well as trying to maximize your time and not stand outside for hours waiting, we also don't want to expose people at this point to community transmission risks as well. Are we going to vaccinate patients? So I guess the short answer is yes, but Shane, I know you've got a plan in place for that. So
yeah, we do. So we haven't implemented it yet because we're in the planning phase. So I suppose there's two different elements to it. So there's the a priority patient initiative, which has been launched, where units are able to nominate patients to be able to receive a priority vaccine. But we are working through the logistics of an expanded service where we will offer training to staff that work in our wards and departments to be able to legally administer the vaccine. And then the thought is that that the medical unit or the treating unit will be able to, if they think it's appropriate, order a vaccine for a patient or an outpatient in the case of dialysis and other patients like that, and then any of the staff that have been trained to be able to administer the vaccine, we can get the vaccine pre-drawn up and ready for them. We'll have some simple forms just for them to complete, and then we'll do all the paperwork behind the scenes in terms of getting the patient loaded up into the system. So we're just working through the logistics of that at the moment, but we're pretty close to being able to launch that.
Thanks, Shane. I think there's a pretty strong indication from government that they would like us to, get to those vulnerable patients, particularly the inpatients, but also those outpatients in dialysis and, radiation therapy, etc., that, are vulnerable by design. So we're going to try and make sure we can offer that vaccination to all of our patients and get the status and or sort them out in an appointment. Can midwifery and I guess other students access the COVID vaccination service as a sort of priority? Shane, are they a priority person as a student?
It's really at the moment we're trying to keep it to Western Health staff at this point, and it's needing to come from a Western Health email address or a DJHS email address to be able to access it. It's not to say we can't extend it in the future, but we've got over 9,000 employees ourselves at the moment. And if we look at that plus family and others, that's a lot of people to get through. So I think it will be a staged approach. So that might be a future thing, but at the moment, it's really just staff at this point.
And as you say, Shane, we've got just over 9,000 staff now. I think looking at the numbers, we've got 70% of our staff that are fully vaccinated and about 84% that are single dose. I guess a bit of a plea from me is if you have your vaccine elsewhere, please fill in the survey or go on the microsite and find it. It means that we can update our records and know your status. So it's really important that we know that, because our friends in the department continue to ask us what our numbers are in terms of vaccinated staff. So, well, as you say, Shane, students not quite yet for priority, but they can book in a slot and get in that line as well. And the same stands for their families at the moment. So students can't get their families into our priority line at this point, or in the friends and family kind of bit. That's reserved for Western Health staff, because students can't work in those COVID hotspots. So it's only for staff at this point. So students can book in through the normal process. And I know there's been a continued increase in capacity across both primary care and in our own hubs. So there should be plenty of opportunity to get an immunisation. Where's the next one at? Is it possible to develop a QR code for tea rooms that auto-populates name, phone numbers, etc.? I don't know is the honest answer. I'm sure it's possible, but we'll have a look. I don't know which one we're using and what product, but they evolve all the time. So we can take that one away on notice. And I'm sure the guys have heard that and will do their best to make life as easy as possible. Shane, will we be testing all inpatients that present with these saliva tests, do you think, anytime soon?
Not that I've heard of, Russ. As things evolve, though, that might become something that becomes possible, particularly in high-risk areas like emergency departments. But there's no firm plan at this point that I'm aware of.
Okay. I think they're talking about it as a pilot, if they can get enough of the tests to come in, but I've not seen anything yet written to say that. So here's one that will certainly take on notice and action. So someone asks, outside of break areas, there's often no hand sanitizer, clinical wipes, or a fresh mask to put on after break. Can we sort it out, please? So yes, we'll take that one on and make sure we get those areas stocked. Hopefully we don't run out that quickly, but good to see that hand gel is being used. So we'll sort that one out. Marion Kana, we might bring Marion in as well, because she's saying that she can speak to saliva testing. I'll get that in a second. Are there any plans on how to cope with staffing deficits with the amount of staff being furloughed? Shane, any views on that one? I know you're working hard to continue to find workforce to meet the requirements.
Yeah, we are, Russ, and it would be fair to say that the staffing situation this year is markedly different to what it was last year, and is much more challenging. But we do have a number of plans in place, and we are doing active recruitment at the moment. One of the things from a nursing and midwifery perspective that we're doing is that we're doing a lot of recruitment of non-nurses who are able to actually vaccinate under the emergency orders, with the intention that if we do need to surge our workforce, that we would be able to free up some of the nurses that are vaccinating and working in other locations by relieving them from by this other workforce. So that's actively happening at the moment. And, we hope we don't have to use it, but certainly those plans are in place in case we do.
Thanks, Shane. Another question in there about, will patients have a choice as to whether they receive a vaccine or not? So yes, we won't be forcibly giving patients vaccine. They will have to consent to have it, but we'll be offering that to them, and they may actually take that on. If they don't, they don't. So it's not a requirement. So as I say, it's offered in the way of offering extra protection to the patients. And whilst they're an inpatient, it saves them having to book an appointment and go anywhere else. Marion, do you want to talk about saliva testing? You should be able to come on now.
Yep. Can you hear me?
Yep.
So at the moment, as Shane said, we have the saliva testing as part of the surveillance testing. At the moment, all the testing that is done at Western Health is the PCR test. The thing, and it's also within the PCR test, there is the Gene Expert, which has a rapid turnaround time, but that's a PCR test. There's also the rapid antigen test, which is a different test that's sort of like a pregnancy test that can be done with about a 15-minute turnaround time at the bedside. And there's talk about using that as a pilot, for example, in the emergency department or for dialysis patients or day procedure or other people coming in for day chemotherapy. So there's active discussion with regards to using those, not at home, but within the healthcare setting. There's also discussion at TGA with regards to whether a healthcare professional needs to go and administer this rapid antigen pregnancy-like test, or whether that can be done at home by a non-healthcare professional. So there's multiple layers to this, but there's some active discussion going on at the present time with regards to using this rapid pregnancy-like test, potentially in the emergency department. What is important to note is it's not as sensitive and not as specific. So if it's a positive test, we always want to confirm it with a PCR test, because sometimes they are false positives. So it will show up as a positive, but the person doesn't actually have COVID. It tends to work better when the viral load is very high. So if a person is just starting at the very, very beginning of getting COVID, it may not pick those up. So it's not, it helps identify some people, but it's definitely not a perfect test. And just because somebody tests negative on that does not mean that they do not have COVID. So there are some significant provisos associated with it. But as far as I know, we have not yet received any at Western Health to go and pilot them as yet.
No, we haven't. Not as yet, you're right, Marion. There's probably another one for you, Marion, on here, which is about Novavax. Are we going to get it? And if so, is it different to Astra?
I hope we're going to get it. I hope the rest of the world gets to get it, because it looks like an amazing vaccine. It is a different vaccine to AstraZeneca. This is a protein-based vaccine, like many of our other vaccines, which we've used for non-COVID in the past. Unfortunately, they're running into issues manufacturing it. And so it's an issue of the pharmaceutical company not being able to manufacture it in large enough quantities with the appropriate quality requirements. I really hope that is a vaccine which we can use. It would be wonderful to have that addition to the vaccines which we can offer. For example, it would be a perfect vaccine to go and use as a booster vaccine. So we would love to have that. But at the moment, the manufacturing is just very, very slow. They're running into issues with regards to that overseas.
Okay, thanks, Marion. I know at the last webinar you and I did, we talked about boosters, and at this point, boosters aren't coming into play. I know there was an article in today's press about the AMA advocating for booster shots, but ATAGI haven't yet given any indication of boosters, and the primary role at the moment is to vaccinate people that haven't had any vaccines, because that's what will keep folk out of the ICU and out of inpatient wards. So we'll continue to keep people appraised. And just on a vaccine bit, Moderna is another vaccine that's coming into Australia. I think it's expected to land towards the end of this month. Moderna will go to pharmacists, so it's unlikely at this point to come into the health service or a public health setting. So if you want Moderna, it'll be pharmacy-led. And there is a question in the chat that is asking about cross-vaccination. So at this point, again, ATAGI are not approving mixing of vaccination doses. That may change. I know there's been some studies overseas in Canada, and I think Marion, Germany, or Shane, Germany and Europe have done some, but certainly it's not approved here yet. So you get your 2 shots of whatever vaccine you get. It shouldn't be mixed. And that's the way it's currently established. I don't know, Marion or Shane, if you know any more on that about emerging evidence or efficacy of that.
It looks like it's highly efficacious, especially, having something such as AstraZeneca, especially having AstraZeneca followed by a Pfizer, seems to get a really, really, really good immune response. But depending on what that dose interval is, if it's a short dose interval, such as a 4-week dose interval, then people tend to get more reactions than they normally would if they just had 2 Pfizers or the second dose of AstraZeneca, but not so much if there's a 12-week dose interval. But it's not yet approved as a strategy by TGA or TAGI at the present time. And then I saw one of the other questions, what is the minimum dose interval if you've had COVID? Can you get vaccinated? There's no minimum dose time interval between you having had getting a vaccine. I'd only do that. If you've received monoclonal antibody treatment for COVID, in which case you've got antibody in your blood for 3 months. Being vaccinated in that time will work. Or this is much more for children if this inflammatory syndrome.
So you broke up a bit there, Marion. So I think if I paraphrase, if you have COVID, once you've done your days in quarantine, you're free to get vaccinated after that point because you're going to leave home legally. You're not under a quarantine order. But if you've had antibody treatment, it's 3 months, I think was what you said. I'll look for Shane.
Correct.
Sure, I've got that. Yes. There we go. Yep. So as I say, if you have COVID, then once you're cleared by public health units to leave home, if you've done your 14 days in quarantine, you can go off and get vaccinated at that point, unless you got treatment with antimicrobials or other treatments.
Sorry, not antimicrobials. Sorry, just to correct. It's not antimicrobials. It's a specific monoclonal antibody against the SARS-CoV virus. So antibiotics are fine. It's this monoclonal antibody, not antibiotics.
Yeah, okay. Sorry, my mistake. Thanks, Marion.
Thanks.
Opportunistic vaccinations for outpatients. So yes, conscious that we're moving folk off-site to telehealth and reviews. So we'll be reminding folk, I guess, as part of those contacts to get vaccinated, and there may be some guidance from the DH that our clinicians on those calls will try and check the vaccination status of patients to record it that are on those telehealth appointments. The script hasn't yet been formulated, but I think there'll be a request for us through those contacts to encourage vaccination of patients. So we'll keep you appraised of what that looks like. But yeah, in thinning out the attendance at hospitals to not have people coming in, outpatients is largely moving to telehealth, but we'll continue to use what opportunities we have to get people vaccinated or to encourage them to get vaccinated. Do we need QR codes for balcony areas because it's outdoors? I would say yes, because we know that COVID can spread and it spreads outdoors, like the MCG and the Amy Park exposures. So I think to give Shane and the IPC guys a chance to find you, QR code everything would be my sense. But Shane, do you want to correctly add to that?
Yeah, Russ, we're really interested in putting QR codes anywhere where people are taking off their tier 3 PPE. So their N95 mask and their eye protection. So, and it's really is around helping the contact tracing teams to get to the bottom of things as quickly as possible, and also hopefully stop furlough, because we always take a conservative approach. And so if we have good information, it may stop people being furloughed when we otherwise might have.
Thanks, Shane. There's also a comment in the question section around folk that got their first jab at Footscray. It was handy to walk down, get it, and walk back upstairs to work. So I think you sort of said you have a look at that and communicate to folk. So we'll come back to people with any pop-ups at Footscray in the near future. So watch this space. Marion, here's one for you. Is Queensland University any closer to getting a safer vaccination?
Oh, I'm not sure where they're at, but they looked like the clap which they were using was going to be a great technology, but it was causing false positive HIV tests. And so they stopped that, and they're working on some, on using a different virus for the clamp. But So they're working on this. It will be a second generation, not right now to help us right now, but hopefully, we are very hopeful that we're going to get a second generation of vaccines against COVID that will hopefully that will work even better and provide what we call sterilizing immunity, so that at the moment with Delta, the chances of you getting infected with COVID is much reduced, but you can still carry COVID in the nose on occasion and pass it on to others. And these newer vaccines would prevent that from happening. So sterilizing immunity. So that would be really helpful.
Thanks, Marion. The vaccine that I mentioned was Moderna. It's coming to Australia. The other one that we talked about was Novavax, which isn't yet in mass production enough that it's coming. I don't think we've secured any of that through a Commonwealth route. But I know that the infection prevention team and the public health units are looking at vaccination status of staff in terms of furloughing conversations. So there is now a risk matrix that is used when decisions about furloughing staff are being made. And that is a risk-based approach that does consider factors about exposure time, proximity, vaccination status, etc. So vaccination status and furloughing is going to be one of those kind of areas that will get looked at. And that's currently in train at the moment. So there is a new risk-based thing that the department have launched following some mass healthcare vaccine exposure events that furloughed, significant numbers of staff, and the Melbourne experienced that. So the risk-based approach came in around the first weekend of that, when I think they had something near 900 staff potentially being furloughed. So vaccination status will be used for furloughing or not for furloughing, is the proper answer. Will there be more Footscray fit testing? So yes, I think Paul and the team are working to make sure we can get more fit testing slots, both in and out of hours for staff. So we'll continue to communicate that through the bulletins and try and get more capacity. I know the gang are working flat out and every slot we have is booked. So putting on more capacity is a bit challenging, but I know they're trying to do that across the day and into the night. Someone said there's some questions in the chat. Okay, here's one, Marion, for you. There's some reports about males becoming sterile as a result of vaccine. Is that true, or is there any information out there?
That is absolutely not true. However, we do have information that COVID, the disease, can make sterile. So you absolutely want to, if that is your concern, you absolutely want to go and get vaccinated, because COVID actually does result in significantly reduced sperm counts.
Okay, thanks, Marion. So that's good to debunk. So the opposite is true. If you get COVID, you're in trouble. If you get vaccinated, you're not. Someone's asked about CBR, so the space over at Sunshine that's currently being used to support patients that have been exposed or have COVID for dialysis. There isn't a long-term plan to use that space for dialysis. I think at the moment it's fulfilling a need, and that will be the continued use of that until the restrictions lift and we get back to normal service. So as far as I know, the space will get returned to CBR once patients are vaccinated and the restrictions lift. It's just a situation at the moment where we can use that space to provide a service to patients without risking infection of others. And Shane, you're probably way closer to that than I am.
Yeah, I was just going to say, Russell, as well, it's also just to provide some reassurance that there's been detailed work on the air handling as well of that space and the space that is being used for the high risk patients or patients who have been exposed to COVID is completely separate from other spaces within the building as well. So so that's been confirmed and looked at and assessed by our engineering as well as our infectious diseases and IP experts as well.
There's also a question about contractors, family members getting into the Western Health priority booking. So at this point, I think the answer to that will be no. It's staff first and foremost, and then we can widen it after we've sort of done that bit. So apologies to contractors, families and contractors, but that's just for the staff and their staff's family at this point.
Russ, we have worked with some areas like engineering who have contractors who are on site all the time. And so we are arranging some separate arrangements for those people. But yes, but they're being undertaken on a case-by-case basis.
Where are we at? Will there be more fit testing? We've done that one. There's a comment in there about, given that the vaccines are in a trial phase, why would it be mandated? So Marion, you're probably best placed to say that I don't think we're in a trial anymore for the vaccines. There's millions of doses that are probably bigger than any randomized controlled trial.
Yep, I would probably say there is no other medication that we have, that we're currently prescribing or using that has had as much usage as these vaccines, with very careful monitoring of it. So absolutely, no, this is not a trial phase. We've been multiple randomized control trials, and this has been used in millions and millions of people. So we've got excellent safety data.
Okay, thanks, Marion. If staff have had a significant reaction to their dose 1 of the vaccine and are unable to not get, how are they going to get advised about getting the second dose? I guess, Marion, that's through the VICNIS service that is the anaphylaxis piece.
Yeah, the VICNIS service. So they would need to be seen there. There is unfortunately, there is enormous demand for that, and so there may be a delay, but you need to get your GP to go and put in a referral with all the information. It doesn't go, and it has to be from a professional email address. You yourself cannot go and fill out the form. It has to be from your primary care provider. And there probably is at least a 3-week to 4-week delay for people to get seen.
Okay, thanks, Marion. So if you've had a reaction, book through your GP to get a review and check out with the experts. Shane, I know there's been a few questions on QR codes, so I think you've got a bit of an update on that one.
Yeah, I do. Just to let people know that there has been an issue with Android and Samsung phones reading the QR codes that were released this morning. That's now being rectified. So we ask managers though, any QR codes that were printed out ahead of 1:30 this afternoon, if you could actually reprint them again, then they will be able to be read by all different types of phones.
Thanks, Shane. Access to N95 masks is becoming more difficult due to the stock across the stores. Nurses are getting fit tested for many brands that are extremely difficult to get. What is being done to restore supply? So last I checked, we had plenty of supply and the state had got a fair bit as well. I guess the demand has gone up as more health services have moved to N95s as we did many weeks ago. But I know the state have got many millions of dollars of kit on order, and that's still coming in. We want to fit test you in as many masks as we possibly can get to future-proof it. So we know from wave 2 to now, some of the suppliers have changed. Some of the masks aren't coming in anymore. So we want to make sure that we can fit test you to as many masks as possible. So you've got a range of things to wear if different brands get under duress in terms of supply. But I'm not aware of any sort of, low stock at Western Health, but I'll certainly take that one away and check. Do we know about a new strain of COVID? I didn't think there was a new strain. I thought Delta was the new kid on the block that was causing all the damage. But Marion, I don't know whether you know anything in terms of a new strain.
Delta is sort of out-muscling every other strain at the moment because of its tremendous infectivity. But, as long as there is uncontrolled transmission, we're seeing evolution in action. And so mutations may happen. It probably will be a variant of Delta. But if there's anything that's going to arise, it likely will be a variant of Delta, not a completely new strain.
Okay, thanks, Marion. Shane, this might be helpful for you, although I'm not so sure Sandy would be very happy to lose more of our workforce, but there are a team of nurses from Bacchus and Melton that have completed the immunisation course and the COVID vax courses. So that may be a request for them to get put to good use vaccinating folks. I'm sure we can happily help find them a home.
Well, it's great to know that. So thanks for sharing that information. And even if they don't get used in the vaccination hub, they could be utilised in their normal job in vaccinating patients as well as staff and others as well. So thanks for sharing that information, and we'll reach out.
And Lisa's already said she'll have them, so I'm sure she's making inquiries for that. So thank you for putting them in the chat. Here's a question, Marion. What is the MU strain?
It's another strain of COVID, but it is currently being out-muscled by Delta. Delta is just so incredibly infectious. So people are watching it closely, but at every time, it's like if there's a race between the two, Delta wins every time at the moment.
Thanks, Marion. And Tash has put in a question in the chat about if anybody wants to be a contact tracer. Kate Cranwell will happily have you as well, as the PHU guys are under the pump doing a huge amount of contact tracing for our community. So we're averaging about 110 interviews every day in, day out. So the guys are doing a great job to continue to support the contact tracing efforts across the state. So if you fancy a bit of a career change, or you want to do a bit of contact tracing, Kate's the person to talk to. That's all the questions. I want to thank colleagues for jumping in and taking the questions. I want to thank you all for watching. Thanks for the comments in the chat about the Are You OK Day and the donuts. I'm glad they went down well. It's great to see a comment about how proud people are to work at Western and be part of a wonderful organisation. So that's really heartening. So thank you for putting that in the chat and sharing it. As always, it's going to be really tricky going forward at this point. We're going to ask a lot of healthcare staff. So thank you in advance. Please protect yourselves and get vaccinated. Please look after your well-being. Reach out to your managers and the emotional support from Karanish through the Employee Assistance Program or the wellbeing programs that I know we're running as well. We're in for a bit of a rough ride, I think, for the next little while. If we get sort of 800 plus patients in our hospitals, that's going to be challenging. But I know everyone at Western will do their part, and thank you all in advance. And as I say, please get vaccinated and look after yourselves. Thanks all. All the very best.